Hello, WealthCon and HealthCon members. Today we are going to see the running related injuries and how to prevent them. As most of our HealthCon member are in a fourth decade of their life, 35 year of age minimum, our joint muscles and tendons are inherently weak because of wear and tear of so many years. And on the top of that, we must have joined HealthCon lifestyle regimen, along with that, brisk walking and running. And this will bound to get you some aches, some pain, sprains, some stitch. It's natural and it's normal. As we do any kind of activity, there is a development of lactic acid into your muscle, which get washed away over the period of time. But if production of this lactic acid is more than this washing out rate, then you want to get pains and aches. But if this pain, aches, if remain for more time, more than a couple of days, then there is a cause of concern. And that is the reason in our HLR regimen also, we have 1 day of rest for this muscles to recover. But in spite of all this, if your pain and ache is not going, then please consult your physiotherapist or orthopedic friend and see what is wrong with you. Essentially, there are two types of running related injury, acute and chronic injuries. Just for the sake of distribution, we are calling them acute and chronic injuries. Few of these acute chronic injuries are acute sprains, acute strains, and stitch. Sprains are partial tear into your muscle, ligament, or tendon, and strains and stitch is a overstretching or it's a complete tearing of your muscle. You may get sometimes there is a excruciating pain on the lateral side of your abdomen, that is called as abdominal stitch. This is one type of injury. Second is ankle sprain, especially if you are landing on a uneven surface, like during rainy days, if there is a surface is slippery, you slip and there is a ligament around the ankle get stretched or torn. This is an ankle sprain. Another type of injury is a knee injuries. These are usually overuse injuries, and this is because of improper running form. This can lead to a patellofemoral pain syndrome, or you call it runner's knee. Sorry. It's a dull pain around the front of your knee, especially when you climb down the stair or you climb up the stairs. That time you get a pain around the knee joint, in front of the knee joint. Another type of injury is a iliotibial band injuries. This is a band from on the lateral side of your thigh, and IT band syndrome pain usually around the knee on the lateral side, which may extend up to your hip. This is a iliotibial band pain or syndrome. Another type of injury is a shin splints. It is very common in runners. This is a pain along the shin of your tibia, and this is a precursor of your stress fracture. So you should be very careful if you have got a pain along the shin of tibia, and if it is not going away, then you have to consult your doctor. Shin splints are usually increased with the increase in activity, and this is again one kind of a stress or overuse injury. Another very important injury is plantar fasciitis. And this plantar fascia is a fascia which is on the plantar surface of your foot from your heel to the toes. But pain of plantar fasciitis is typically at or near your bottom of a heel, and especially felt after the activity, not during the activity. or next day in the morning, while you start walking, then you get the pain in a heel. That is a plantar fasciitis. And this is a late symptom of your posterior column problem. I'll tell you in a short what is the posterior column of your body and how it will cause the plantar fasciitis. Then another injury is Achilles tendinitis. This is a pain just above the heel on the posterior side. This is again a chronic overuse tendinopathy. And as I have mentioned, another injury is a stress fracture. These are the small cracks in the bone affecting the weight-bearing bones, especially tibia and metatarsal. So before the fracture tibia or stress fracture, you will get the shin splints, and then you go for this will go for the stress fracture if it is not properly treated. So these are the few injuries which I have mentioned. There are a lot of injuries, but these are the important and main injuries. And how to prevent these injuries? So what are the prevention strategies of these running related injuries? Foremost thing is you should have a plan and then progress slowly. What does this mean? Whenever you are having any running goal, then you must have a proper plan. And then your progress should be slow. As a thumb rule, you should not increase your mileage by more than 10% per week. Second thing, do not increase the speed and the distance at the same time. Focus one at a time. Distance first, you keep on increasing your distance and then you can increase your speed. If you are trying to run both further and fast, then there are the highest chances of injuries are there. Next important thing is a proper warm up. 10 to 15 minutes of head to toe warm up, which we have shown in our HealthCon live videos, is very important before any running activity. And this will prepare your muscle, make it warm for your running activity. Importance of footwear. We should have a well-fitted supportive footwear, shoes appropriate for your foot. Make sure your running shoes should be tight enough, but not too tight. The thumb rule is you should have a half a size more than what is your size on that size measuring tool, which is present with the shoe selling stores. So half size more. That is the proper size of your footwear. It will prevent your black toe. Next important thing to prevent injuries is cross training. Importance of cross training, we cannot emphasize more. Cross training is, for example, cycling, swimming, strength training, skipping, hiking, kayaking. These are some of the cross training techniques that they should be added into your routine to reduce the repetitive stress on your body. Next important thing to prevent injury is proper running form. There is a very good video which was shared by one of our HealthCon friend, Dr. Abhay Lunesar. Running is a control fall. So your upper body will come forward first, and to balance that fall, your leg muscle will properly work to prevent that fall. So your upper body should come forward first while running and then your legs. And for this control fall, you have to have your abs and core muscle very strong. So the entire load of running will get distributed on your upper body, that is a core, and lower body, that is your leg. And this will prevent your injuries. So this is a proper running form, is very important for running. Next is rest and recovery. at least 7 to 8 hours of uninterrupted deep sleep is very important per day. And 1 day per week should be a no workout day. In our HLR regimen, we have a Monday where we don't do any workout. And this rest day or rest and sleep, this is very helpful for the recovery and repair of your muscle. Very important. So it is the part and parcel of your regimen, rest and recovery. Next important thing is stretching. We cannot emphasize more on stretching and flexibility training after your run. Stretch helps to keep your muscle long and flexible. If you don't stretch, then your muscle become tight, and that tight muscle are very hard to move properly and leading to the poor running form and ultimately the injuries. So stretching is very important. You should stretch before run, stretch after run. Only thing to remember, if you want to stretch before run, you should do some warm up 10 to 15 minutes and then stretch your body for running and then start running. Here comes the importance of stretching and posterior column stretch. What is this posterior column of your body? Posterior column of your body consists of calf muscle, muscles on the back of your thigh, that is hamstring, then glutes, lower spine, upper spine. So if you stretch this entire posterior column, your weight get distributed, your training load get distributed, and you won't get the pain in your heel. That is a plantar fasciitis. So to prevent the plantar fasciitis is a late symptom of problem with your posterior column, starting from calf, your hamstring, glutes, lower back, upper back. So that is the importance of your posterior column stretch. Next point is proper nutrition and hydration. We cannot emphasize more on this part of our HLR regimen, that is a nutrition, very important. Good quality carbohydrate, natural proteins, and good fats are important constituent of our running regimen or HLR regimen. Next important point is a proper hydration before run, during run, and after run. We keep on sipping a small sips of electrolyte rich solution like Enerzal or anything which you like throughout your run, at least every 15 to 20 minutes. You keep on sipping before you feel thirsty, because thirst is a late sign. And if you are thirsty, it lead to the dehydration and one of the important cause for your cramps. There are 3 important reasons for your cramps: dehydration, electrolyte imbalance, and third one is a hypoglycemia. So while a long run like a 21 kilometer or 42 kilometer, you have to have a nutrition plan ready with you. For 10 kilometer, nutrition is not that much required during run, but post run, when you come back after your running and after your stretching, you should have a hydration. You should have a energy dense carbohydrate, for example, banana, and then a good quality protein within the 30 minutes of your training. Apart from that, micronutrients, vitamin C, vitamins, zinc, magnesium, antioxidants are also very important for the recovery and repair of the muscle as well as to prevention of the injuries. Last but not the least, listen to your body. Pay attention to any signs of discomfort and pain and address them properly. Thank you, friends, for patient listening, and all the best for your running related goals. Happy rainy day running, guys. Thanks.